Hello everyone, this is your Krishna from Women Today YouTube channel. So in this channel we have been doing offline and online interviews with women entrepreneurs across different cities in India. We are just traveling to different cities and we are doing offline interviews in their office location. And we are also conducting online interviews across different cities in India and also across different countries in the world. So today right now we are in Mumbai and right in front of us is Dr. Suhani Talesara. So good afternoon ma'am. So I welcome you to this Women Today YouTube channel. So yeah, right now we are in Mumbai in this doctor dentist clinic. So please kindly introduce me about yourself, about the kind of work that you're doing to the audience who are watching this interview right now, ma'am.
Hi everyone, this is Dr. Suhani Talesara, owner and founder at Dr. Dentist Multi-Speciality Dental Clinic, Mumbai. It's been 13-14 years that I'm into the field of dentistry, and it really gives me an identity. It really makes me who I am today. So I'm really glad that I'm able to share a few moments with you all.
So that's a great introduction from you, ma'am. Of course, 13 years is a long journey in this industry. So also tell us, ma'am, there is a lot of professions existing in the market right now. So what really inspired you to become a dentist right now, ma'am?
So it's a very funny thing which happened with me when I was 12 years. I had my braces, and when I saw that my crooked, crowded smile could get transformed absolutely and I could achieve my dream smile, I think that was the time when I realized, when I decided that, okay, if I'm going to be anything, I will be a dentist.
So that's a kind of childhood kind of motivation for us. Of course, if this braces is going to make me smile, then I should make others also smile.
Yeah.
So that's what some or the other made you choose this professional career in your subconscious mind, because whatever we think as a childhood, I mean during our childhood age, that will be coming and that will be like building up.
It shapes up your mind.
Yeah, that's it. So you are just making sure that, okay, you are just making sure that you are doing in a very sharper way. You're making it sharper each and every day. So right now you're a total full 100% professional in this industry. That's a great thing, ma'am. So tell us, ma'am, nowadays the latest trend is smile makeover. So also tell us what is the real meaning behind this smile makeover, and what are the procedures that we can expect when we come as a client to you and when we do smile makeover procedure with you, ma'am.
So see, anything that enhances your smile, anything that changes your smile, that transforms your smile, comes under smile makeover. Now it can be ranging from a simple teeth whitening procedure, or maybe composite bonding, porcelain veneers, and if we talk about aesthetically aligning your teeth, then even the orthodontics, which is aligners or braces, also come in the category of smile makeover.
So also people will be having a lot of kind of dilemma. Will it be very painful, something like that? And also tell us, if I'm coming to you today, so I'm just kind of asking you to do a smile makeover for me. So how many days will it actually take to complete this full procedure till the end, ma'am?
So it all depends on the complexity of the case. So say for example, if it's a teeth whitening procedure or a composite bonding, it can be done right on the chair and it's not more than a half an hour procedure. Having said that, if we have to do porcelain veneers, it will take about 7 to 8 days or maybe 10 days. But any kind of orthodontic correction that needs alignment and changes in the bite, that would take approximately a year or maybe a year and a half, depending on what is the severity of the crowding.
So basically, a minimum it takes for half an hour, and maximum it takes like more than a year, something like that.
Absolutely, it ranges, yeah.
Okay. So also tell us, ma'am, what is the minimum cost that we can expect for a smile makeover in India? Because consider foreign countries, they will be like charging more, but in India, there will be like a certain amount. Tell us about the budget. And also people will be worried like, okay, if you are going to invest something for smile over, then how long will it last? So these are the things which will revolve around people's minds. So tell us about it, ma'am.
So smile makeover procedures, say for example, if you're doing whitening will cost you somewhere around 10,000. Composite bonding will cost you somewhere around 15,000. Porcelain laminates, if we do full mouth cases, then it will cost you somewhere around 2 to 4 lakhs. Coming to aligners and braces, now braces also there are multiple kinds: metallic braces, ceramic braces, lingual braces, which ranges somewhere between 35,000 to 1 lakh. Aligners, so start from 80,000 to 2.5 or 3 or 4 lakhs, depending on the number of aligner sets that are going into your correction. So it ranges. It all depends on the modality of the treatment that the patient really needs.
So that's what people who wants to have smile makeover, they should be kindly make sure that whatever things they needed to be get done. So the charges vary accordingly.
Absolutely, yeah.
So also tell us, ma'am, like if we come for a smile makeover, people will be thinking like, okay, there will be a specific age category kind of thing for this. So is it like that, or any age category is fine for the smile makeover, ma'am?
Anybody can opt for smile makeover as long as you're not under 12. So yes, anybody who's not confident smiling, who's conscious when they are clicking their pictures, or who have occurrence of multiple cavities because of crowding, because of not having proper bite, they are all candidates of smile makeover. So there is no contraindication that okay, you cannot do smile makeover. Except that if you are a child, of course, if you are under 12, then you should not be opting for it.
So also tell us, ma'am, people will be worrying like, okay, we are just going to give our teeth to a person who is totally like a stranger to us but a professional. So tell us, how can we pick up the right dentist to make sure that we have the right smile makeover treatment, ma'am?
That's a very tricky question, especially when dentists are mushrooming. We all know that there are a number of dentists in any lane, any street you go. But yes, how to understand the credibility of a dentist? You can look for before after pictures, you can look for Google testimonials, any online testimonials you find about that doctor. And I also feel that the major connect happens when the dentist is actually able to understand that what exactly you're looking for. Once you understand that the dentist has really understood your image of an ideal smile, is that's when you should just give up to the dentist, that okay, you should just leave everything up to the dentist, that is the right dentist for you.
So basically like whomever dentist you are going to get your teeth get done, so make sure that they have a lot of testimonials with them. Because once we see, our brain will be able to make a mindset like, okay, we are just going, it reinforces and make sure that no need to worry, we are just going to a thorough professional. So it's just like traveling in another craft, putting our life in the hands of a pilot. So as simple as that. That's a great thing that you are doing to the society, ma'am. So also tell us, ma'am, there is a lot of dental implants happening over here. So people are just really wanted to know what's the real meaning behind this dental implants, and tell us, when do we really need this dental implant treatment in our life, ma'am?
So dental implants are nothing but titanium posts that are placed at the places where we have missing teeth in your jaw bones. Now a lot of people feel that once the teeth have been extracted, they don't really have to replace them, which is the biggest mistake that patients do. So whenever we remove any functional tooth, replacement is equally important, and if you don't do it, then they have repercussions which they have to face later. So how do we replace a missing tooth? We have two options. One is a dental implant, second is a dental bridge. Now here we are talking about the dental implant. The process is absolutely painless because everything is done under anesthesia, and it takes about 30 to 60 minutes depending on the number of implants that we are placing, and it's absolutely safe. The material, the titanium, is absolutely chemically inert. It's the same material that is being used in pacemakers, so it doesn't react once it goes inside your body.
So the next thing, I mean, the very first thing, again, when it comes to a dental implant, like, okay, people will be worrying like, okay, if you are going to fix a single tooth, it will be costing us like this much amount. And also if it comes to a full mouth, because I have seen many people, I have also seen my close friends, they have made a dental implant like each and every teeth of the entire mouth. They have implanted. I think it cost like more than a lakh, something like that.
More than that, maybe.
More than a lakh. So tell us what's the real kind of cost behind this, or also tell us about the recovery period, because people always will be worried like, okay, we are just going to have some proper food, so we should chew it, and also at the same time we should attend many functions. In India, functions are a normal thing which happens, in festivities are normal things over here, and also at the same time we should go to work and we should face our work colleagues over there. So what is the recovery time for it, and also tell us about the cost as we spoke in the before time, ma'am.
So the cost of implant depends on the system that we are using, because there are different brands of implants available, like how you would be having a Maruti Suzuki or you will be having a BMW Audi. So similarly, we have multiple options when we do implants. Now for any healthy young patient, we can offer all possible brands. Usually in our clinic, the implants that we do range between 30,000 to somewhere between 65,000 if it's a single implant. If it's a full mouth case, which is all on 4 or all on 6, it ranges between 3 to 8 lakhs depending on if we are doing one jaw or both the jaws together. So the healing period is basically what happens is once the implant goes inside your bone, the bone cells get integrated with the implant. The process is called as osseointegration, which is about a 2.5 3 months process. After 3 months, 3.5 months, when we recall the patient, then we deliver them the crown or maybe the prosthesis over those implants, and that is when the patient starts chewing and using them fully functionally.
So yeah, of course, we are coming. It's like a normal surgery.
It is, and it's a very very normal surgery, because the fact that when people hear it that, oh my god, this is an implant surgery, I don't know what will happen, they will give anesthesia and they will do cutting and everything. So dentistry has evolved a lot. We have a lot of new technologies, because of which we don't really have to raise the flap every time. We just pinpoint drill on the place where exactly where we have to place the implant, which reduces the trauma and makes the experience very very smooth. As far as the healing is concerned, once the patient goes home, we usually prescribe antibiotics and painkillers to all our patients for the next 5 days. So by say 2 to 3 days, the patient is able to start using all the sides normally, of course with soft food initially, and then they go to the normal food. So there's no fear, there should be no fear when it comes to anybody who's planning to get implants done, because it's absolutely safe, it's much recommended, and will give you long term results.
So basically, it's like again, no need to worry about anything when we are going to a thorough professional. So also tell us, ma'am, like, is there any kind of restrictions for this? Like certain people do not want to get any kind of dental implants, something like that. And also tell us about the kind of success rates for this, because people also will be worried about, okay, there are a lot of surgeries happening, but there are very few success rates. So tell us about in this department for this dental implant, what is the success rate, and tell us about all these kind of things, ma'am.
So anybody is eligible for dental implant as long as the bone is good. We've had cases wherein even when the bone is deformed or there is scarcity of bone, we do take support from your zygomatic and pterygoid bone also and place the implants over there. So I believe that there is no contraindication as such. But yes, if there is any kind of bone scarcity where we find, we always place bone graft and augment the bone in that case. Coming to the second question, which was...
Success rate?
Success rate of implants is about 95 to 98% if done well, and more importantly, if maintained well. So a lot of times we have seen that patients, once the implants are done, they go home and they forget about it. They forget brushing, that they have to do their cleanups regularly. So remember one thing, whenever you have got any implant surgery done, it is mandatory for you to maintain your oral hygiene well, because if you don't do that, if there's a lot of bacterial deposition around that implant, there is a chance that the implant can fail. So maintenance is very important. That cannot be ruled out. You have to be very, very compliant with all the instructions which have been given to you by the dentist.
Yeah, it's basically like buying a high-end car. Of course, you can work hard, you can earn money, you can buy your dream car. But the thing is that whenever you're buying a Lamborghini, a Ferrari, or a Porsche, something like that, you should always think about the other side, the maintenance.
Absolutely.
The maintenance cost. It comes with a lot of things.
It's like how you would service your AC, how you would service your two-wheeler or four-wheeler. We use our teeth more often, right? So we need to make sure that we service them well. If we don't, then we know that there will be issues later.
So yeah, the very first thing will be done by our dentist, and the second thing should be done by us. That's the right way to conclude it, ma'am.
Yeah.
So coming to braces and aligners. So tell us what is braces and what is aligners. And also there are different types of braces. So tell us what are the different types of braces in India, ma'am.
So braces are basically brackets that are bonded on the tooth, and the force on the teeth which is being applied is through those brackets, and then there is a wire which binds those brackets together. Whereas aligners are very very transparent looking covers which are given to you, and you have to wear it for about 20 hours in a day, and the action of the aligners is same because they work through those tiny attachments that are being bonded on your tooth surface. Now who is a good candidate for braces versus who is a good candidate for aligner? See, braces and aligners anybody can go for, but the fact that aligners are very very aesthetic, and you can remove them and eat whatever you want to, is something that makes them very much usable for people who are working, who don't really want to show the world that they are getting some treatment done. But at the same time, when we have complex cases wherein we know that aligners will not be able to take care of the treatment, braces are a better option.
So again, coming to the cost part, people will be worried like, okay, what is the cost for braces? What is the cost for aligners? So what will be the time which it will take from the beginning to the end to fix this braces and aligners? And also, aligners is a new term, but braces or something like which is a little bit traditional. So tell us about the kind of working that you do with it, and also tell us about the recovery time period, and also about the cost for braces and aligners in India, ma'am.
So, how effective the treatment is going to be for any patient, I tell all my patients that if you're going to wear the aligners, the treatment will be on the track. But there are a lot of people who don't wear it as per the instructions, and then they expect the treatment to happen, on the expected time. So, a lot of patients who are not compliant, who think that they will not be able to be sincere while wearing the aligners or retainers, they should be opting for braces. Coming to the cost, metallic braces, ceramic braces, then we have transparent looking braces, and then we have lingual braces. So metallic braces start from somewhere around 35 to 40. Ceramic braces are around 45,000. Coming to transparent braces, which are about 90,000. Self-ligating braces are also about 1 lakh, and lingual braces are somewhere around 80 to 90,000. Aligners start from 80,000 onwards, again depending on number of sets that are going into your treatment, because that is decided once the scan is done for you, and that's when the orthodontist will decide that okay, this is the time duration for the entire treatment, and hence the cost is decided.
So yeah, that's a very huge amount. And also coming to this cost, people will be wondering like, is there any kind of EMI options for orthodontic treatment? So tell us about these kind of things, ma'am.
So yes, orthodontic treatment, because we know that it's going to be a year or maybe a year and a half. So we always inform the payment policies to the patients, like 50% of the entire payment has to be made the day we start the treatment, and the remaining can be paid in terms of EMI. It can be 2,000-3,000 per sitting or whatever suits. But yes, before the last sitting is scheduled, we need the entire payment to be cleared, because that's when the patient is given the retainers.
That's a good option. And also tell us, can adults also kind of have these kind of braces and aligners, and how should we choose between braces and aligners? Because if we were given a choice, we don't know what's happening over here. So how can I choose between braces and aligners? And also tell us, how often should I come and visit a dentist? Because once the treatment is over, people will be thinking like, okay, everything is over right now, we can be staying in home with everything, nothing needed to be worried. Because, and also at the same time, there should be consultations frequently which should be happening with any kind of treatment. Maybe it may be a dentist or a surgeon or something like that. So tell us about the frequent visits, about the number of days, how much days the gap should we visit our dentist, ma'am?
So like I said, any patient is a good candidate for aligner as long as the patient is really compliant and wearing the aligners on time. As far as the number of visits which are concerned, so orthodontic treatment has a very important phase which is known as the retention phase. So our teeth are like rubber band. When we align them, they will be in straight line. But the moment we remove the braces or remove the aligners, we know that because the underlying tendency is still such that they will try to get back to their original position. But if that happens, if they try to get back to their original position, the people will be again very, they will feel that, oh my God, the entire time got wasted and the teeth are again crowded. So retainers are given to all our orthodontic patients just to make sure that they wear it for at least 6 months or maybe 6 to 8 months, so that whatever correction has been achieved, it doesn't go back to square one. It stays there, and that's when the bone cells are formed around the tooth, and that's when that position becomes a permanent position.
So basically, these retainers are like a strict guardian, like a strict teacher, making sure that it doesn't go back to its old form, so that it will be making sure that we have a very good success rate in the new form. That's a great thing, ma'am. Tell us, ma'am, what are the most common dental problems in India right now? And also tell us, how often should I come and visit a dental clinic, a dentist like you, and have some cleaning in my teeth? So tell us about it, ma'am.
So I've reiterated this like probably n number of times to all my patients that cleanup is something that you need to do once every 6 months. If you don't have any habits, say for example, if you don't smoke, you don't have any kind of major black tea or black coffee, then once in 6 months is fine. But if you do, then probably once in 3 months, because then you'll have a lot of stains and tartar build up. Now coming to the problems that I see patients coming to me every day, the major problem is that dental cavities which they fail to address on time. Because what happens is, if cavities are not treated on time, if they're not addressed on time, say by cavity fillings and all, the same tooth gets into the root canal stage, because the cavity gets into the third layer, which is the nerve of your tooth. So it's a saying that better late than never. So if you think that you still have a cavity which is becoming sensitive, which you've never shown it to a dentist, I think this is a time that you should immediately go to the dentist, get it checked. If it's in a filling stage, get it filled. If it's not, then please preserve it by doing a root canal, but do not let it go in the stage of extraction, because that is a major loss for all of you.
So coming to the root canal treatment, so tell us, ma'am, is this root canal treatment really painful? And also tell us about the procedures, what we can expect when we come to a root canal treatment. You are saying about extractions, fillings, and all some things like that. So tell us about these kind of procedures, and also tell us whether it will be like painful or not, ma'am.
So any root canal treatment which is done at Dr. Dentist is absolutely painless because we make sure that the entire experience to our patient is smooth and absolutely painless right from the time we inject the anesthesia to the final procedure. So see, everything is done under anesthesia these days. Patients do not feel anything. There are very rare cases when the tooth is actually a hot tooth, or there is some kind of vasoconstriction which is in the patient, because of which the anesthesia is not acting. Otherwise, root canals or extractions or cavity fillings never pain. The fear in a patient's mind is very normal. It's very common to hear that they have not done the root canals because it hurts or it might hurt, but trust me, all these procedures are absolutely painless.
So also people will be like worrying about the tooth decay, the gum disease. So tell us, how can we actually maintain our oral hygiene at home, and how can we prevent these kind of gum diseases and also the tooth decay problems in our day-to-day life, ma'am?
So the basic regime that I tell all my patients to follow is brush, floss, rinse is something that you have to follow every day, and not just once, twice every day. So if you're brushing twice, if you're flossing every day, and if you're making sure that after every meal you're at least rinsing with water, you will ensure that there are very, very less depositions of bacteria around your teeth, and that will in turn lead to less tartar deposition, and you will never have bad breath issues, or you will always feel fresh throughout the day. So if you follow this, I think this is mandatory. This is like a bare minimum, non-negotiable thing for everybody.
So also when it comes to a normal person's life, there will be things like emergency periods, like they may be calling an ambulance, something like that. But when it comes to dental emergency, what should we do for the very first thing? Is it any kind of first aid kit, something like that? Tell us about it, ma'am.
So, to be very honest, Krishna, dental emergency was real during COVID times, when the dentists were shut, when the clinics were not operational at all. And we used to receive calls like right in the middle of the night, the tooth is hurting, what to do, because unfortunately we were so helpless that we had to only prescribe medications at that time because we were not functioning. But now, since everything is up and working, if you ever have any kind of dental emergency, dental pain, say for example pain followed by swelling especially, please do not ignore it. Please do not go to a regular chemist, take some random medicine and try to subside it by yourself. You don't really have to be the doctor yourself. You have to visit the dentist immediately, because if you have swelling, you would never know there will be some kind of pus formation, infection underneath the tooth that can also go lead into your air spaces, which can be fatal. So don't take it very lightly. If you have any dental emergency, I think the first thing you should do is go to the dentist immediately.
So that's kind of scary to me because, yeah, of course, we should not neglect each and every small kind of tooth decays or gum diseases or something like that. Each and everything has some kind of greater impact in the future. Maybe it may be even getting worse, something like that. So I do understand, ma'am. So always people will be worried about the insurance. So they'll be thinking like, okay, will these kind of dental treatments will be covered by our insurance, something like that. So tell us about the basic dental treatments which can be covered by our insurance, ma'am.
In India, dental insurance is still evolving. It's still not evolved to that level. So I always tell my patients that not to depend on their dental insurance completely, because there are a lot of procedures that your dental insurance might not cover. So the simple dental procedures such as extractions, fillings, or some policies do offer for root canals also. But for any kind of cosmetic procedures, say smile makeovers, veneers, or orthodontic correction, braces, aligners, your dental insurance policy will not cover. So it's always advisable to check the policy before you go for any kind of dental insurance, because you'll end up paying your premiums, heavy premiums, but to be very honest, the benefits that you're going to get out of it are very less.
So also tell us about the companies which actually cover these kind of dental coverages, ma'am.
There are few companies I know, which is Star Health Insurance, ICICI Lombard, Bajaj Allianz, and HDFC Ergo. Also, there are few policies which cover the OPD and X-rays in these companies. So you can always check these companies if you are looking for taking any kind of dental insurance plan.
So that's a kind of great things that we discussed about a dentistry industry. So one final question for this interview is very simple, ma'am. Why are this interview? If you want to convey to any kind of message to the people who are watching this interview right now, it may be to the kids, old age persons, or the middle aged persons. What would be that one message that you would like to tell to the audience who are watching this interview right now, ma'am?
So that message would be that your teeth speak before you even speak for yourself, because that's the first thing people notice about you. And I feel that everything in our body, everything when like the entire functioning of our body starts right from our mouth. So it's very important for us to be very, very careful when it comes to taking care of our teeth, our oral hygiene. Let's not neglect it the way we do, because in India we have this very casual attitude towards our teeth, that till the time it won't hurt, it won't pain, we will not even think of going to a dentist. We will go to the dentist only when it starts hurting. So it's time to take our teeth little more seriously than ever. And a small message to all my fellow colleagues that are watching this video, that let's just stick to ethics in dentistry. Let's not make it a business, because we know that ultimately whatever we are not going to do to our friends, families, or relatives, let's not pitch it to any other patient also, because that is something that will take us on a very long run.
That's a very genuine kind of message. Of course, people, who have any kind of department they are working, they should make themselves like, okay, we are treating our own family members. So
Absolutely.
that's a very genuine part from you, ma'am. So people who are watching this interview right now, please do subscribe to our Women Today YouTube channel. Please do click on the bell icon. So today's your host is Krishna, hosting this Women Today YouTube channel, and today's our guest is Dr. Suhani Talesara. So thank you once again, ma'am, for accepting me to host this wonderful interview.
It was my pleasure to spend some time with you. It was a very chit-chatting kind of conversation. I really enjoyed having this conversation with you, and I hope people are able to gain some value out of it. It was really lovely talking to you.
Sure, ma'am. So people who are in Mumbai, if you want to have a visit, you can have a visit with Dr. Suhani Talesara, ma'am. She is in this doctor dentist clinic. So where exactly is this address, ma'am? You can just tell about the office address.
So we are in Andheri, Mumbai, right on JVLR. You'll be able to see our page on Google, and if there's any kind of dental need, any kind of dental treatment you're looking for, please feel free to get in touch with us. You'll be in safe hands. I can trust you that.
So that's a great thing, and I'll also make sure that I'll mention her Instagram link in the YouTube description so that you can have a kind of conversation with her online. So that's a great thing, ma'am. So thank you once again for having all these kind of great dentistry talks. So good evening, ma'am. Have a nice day.
You too.
Yeah, that's a wrap.